How do I understand my raw blood test, results, and terminology? Understanding your rheumatoid arthritis blood test results can feel like trying to decode a new language. But knowing what these tests mean can help you better understand your condition and work with your healthcare team. Let's break down the common tests used in diagnosing and managing rheumatoid arthritis and what their results can tell you. When your doctor suspects rheumatoid arthritis, they usually order several blood tests. The most common include the rheumatoid factor test, the anticyclic citrullinated peptide antibody test, inflammation markers like erythrocyte sedimentation rate and C-reactive protein, a complete blood count, and a metabolic panel. Each of these provides different pieces of the puzzle. The rheumatoid factor test measures antibodies called rheumatoid factors in your blood. If the result is negative, it doesn't necessarily mean you don't have rheumatoid arthritis, because some people with the disease have negative rheumatoid factor. If the test is positive, especially at high levels, it suggests the possibility of rheumatoid arthritis, but it's not definitive. Rheumatoid factor can also be positive in other conditions like certain infections or other autoimmune diseases, and even in some healthy older adults. So, a positive rheumatoid factor alone isn't enough for diagnosis. The anticyclic citrullinated peptide antibody test is more specific for rheumatoid arthritis. A positive result here strongly indicates RA, especially if rheumatoid factor is negative. When both tests are positive, it can suggest a higher chance of more aggressive disease. However, if both are negative, it doesn't rule out RA, especially if symptoms are present. Inflammation markers like erythrocyte sedimentation rate and C-reactive protein tell your doctor how much inflammation is happening in your body. Elevated levels are common in active rheumatoid arthritis and can help monitor how well your treatment is controlling the disease. But keep in mind, these markers can be elevated in many other conditions too, so they are not specific to RA. A complete blood count helps check for anemia, which is common in rheumatoid arthritis and can also reveal other blood-related issues. The metabolic panel looks at kidney and liver function, important for ensuring your medications are safe and effective. It's important to remember that no single blood test can definitively diagnose rheumatoid arthritis. Diagnosis depends on a combination of your symptoms, physical exam, blood test results, and sometimes imaging tests like X-rays or MRI scans. Your healthcare provider will interpret all these factors together. If your results are negative but you still experience joint pain, stiffness, or swelling, your doctor may order additional tests or refer you to a specialist called a rheumatologist. They are experts in autoimmune diseases and can help clarify your diagnosis. When reviewing your results, don't hesitate to ask your doctor to explain what they mean in plain language. Remember that normal results do not always rule out rheumatoid arthritis, and abnormal results don't automatically mean you have it. Tracking your test results over time can help you and your doctor see how your disease is progressing and how well your treatment is working. Always follow up with your healthcare provider to discuss your results and next steps. They can provide personalized advice based on your unique situation. If you have symptoms like joint pain, stiffness, or swelling, it's important to see your doctor even if your blood tests are normal. Early diagnosis and treatment can make a significant difference in managing rheumatoid arthritis and protecting your joints. Your medical team is your best resource to help you understand your results and guide your care.